All right, we had Phillip walk into the office, had an aide take his vitals. Everything was within normal limits. We also had him fill out a dizziness handicap inventory, and the total score was 40 points. Hi, Phillip.
Hi.
How are you doing today?
I'm good.
Okay, good. By the way, our last visit, I didn't know, was there a nickname you go by that you like to be called?
You could just call me Lip.
Lip?
Mm-hmm.
Lip, interesting. Okay, we'll call you Lip. Is that what your friends call you?
Yep.
Okay, cool. All right, so how have you been feeling since the last time we talked?
About the same.
About the same?
Yeah, not much has changed.
Okay. And do you feel like any of the advice that I gave you previously helped?
Maybe. I mean, I think like things might be getting slightly better just because of time, but I'm still experiencing a lot of my headache and dizziness and stuff like that. So,
Okay.
but I mean, I don't know how much it's helped since our last visit.
Got it. Okay. So the reason for our last visit, I did all those tests on you and I asked you a lot of specific questions. I was really just kind of screening out, casting a big net and filtering out, a lot of possible dangerous stuff that might be going on. And I have very good news. There's no red flags, nothing bad that's happening. This is a pretty typical concussion. In fact, my theory is that your headaches may actually be a continuous result of some residual neck pain or some trauma. I mean, this is kind of normal. People who suffer a traumatic injury, like you did, usually will have headache symptoms that persist for a long time. And so, luckily you're here in PT and we can do some stuff to fix that. You can kind of just nip it in the bud. But as for your concussion, I do think it's mostly healed.
Okay.
So not all hope is lost, is what I'm trying to say.
That's good. That's
okay, great. So I'm going to do a few more stuff with you here today just to make sure that we can send you home later with the proper exercises.
Okay.
And you get the most out of physical therapy. So right now, I got this pen in my hand. I just want you to look at the pen. We're just going to go through a series of tests here, okay?
Okay.
So go ahead and look at that pen. Okay. Look at it. Good, and out to your right. Top. And down below. Good. Do that here again. I'm just going to move the pen slowly. You're going to follow it with your eyes. Keep your head still.
Okay.
Good. Any dizziness with those?
Yeah, a little bit. It kind of caused some more headache too.
A little more headache too?
Mm-hmm.
Okay. I am just going to type up some little notes here. So don't mind me if I, turn my back and just typing up some stuff here.
That's fine.
I have just a couple more like that. Do you think you can do those without your symptoms getting worse?
I mean, we could try. Yeah.
Okay. I'm going to hold the pen here, and when I say pen, I want you to look at the pen.
Okay.
With your eyes, and then with your eyes, when I say nose, you're just going to look at my nose, keeping your head still again.
Okay.
Okay, ready? Pen, nose, pen, nose, pen, nose. Good. Now over here. Pen, nose, pen, nose, pen, nose. Good. All right, last one's fun. So I'm going to hold your hands up. You're going to hold your hands up like this. And what I'm going to do is I'm going to hold your hands and I'm going to move you. And I want you to keep your head and eyes locked on your thumbs like this.
Okay.
So I'm going to do the work here. You just keep your head and eyes looking on those thumbs, all right?
Got it.
Might have heard my wrist clicking, so. Any dizziness or headaches with that?
Just a little bit.
Okay.
Yeah.
I know that can be a lot of motion.
Yeah.
And that's another thing we can work on. We'll actually be able to send you home with some exercises that could help with the dizziness problems during movements like that. As a therapist, did I notice any psychotic or any nystagmus? Okay, no nystagmus noted. Okay, so what I'm gonna have you do next, lip. I like that. I like that name. Okay, I'm gonna have you set up on this table. So we'll do that next. I'm just gonna kind of place my hands on your neck and shoulders. If that's okay. Is that okay with you? Perfect. All right, Lip. So for this next part, I'm going to kind of assess some structures with my hands around your neck and head area. In order to do that more accurately, I will ask you to take your shirt off. Is that okay?
That's fine with me.
Okay, perfect. I'll take that off for me, and we'll get started. Okay. So as for tenderness, is there any tenderness kind of up here as I'm kind of pressing along?
No, not too bad.
Not too bad. If I kind of go up into here.
No,
No.
not really, no.
Okay, go ahead. I want you to turn your head to the right and then look down.
Wait, like that?
Yeah, just a little bit. Is there kind of any pain along there now? Just
No.
kind of stretching it. I just want to. No pain?
No, they're a little sore, but I think my traps just are sore in general.
You can go ahead and look straight forward. Your traps are sore in general. Why do you say that?
I think they just kind of like, I don't know, get overworked maybe.
Any tenderness? You can let me know if I hit a sore spot too.
Okay.
They're just sore in general. You just kind of tight there.
Yeah, it is a little tight in that area too.
Okay. How about up on this side, on the right side? Does it palpate up in there?
Nope.
Or sorry, not palpate. That's just a word we use for massage, you could say.
It's okay, our athletic trainer uses that word all the time.
Oh, okay. So you have an athletic trainer. Has he done this to you yet?
I believe not. I think we mostly have like ankle injuries.
Okay. Anything here in the middle of your back?
No.
Okay. Next, I'll have you go ahead and lay down for me, and your head can just rest kind of right here.
Okay.
Okay. Okay. Any pain as I'm pushing along here, or tenderness?
No.
Up there. Okay. I'm just gonna work my way up a little more. Not when I press right up in here.
No, not really.
Not really? Okay. Anything there?
Maybe just a tad bit tender, but
A little tender?
yeah.
What's this do for your headache symptoms?
Might relax it a little bit.
A little bit? Okay. I'm just gonna kind of hold this for a minute, okay?
Okay.
Just gonna hold this pressure. This pressure isn't uncomfortable, not painful.
No, it actually feels good.
It feels good? Okay.
Mm-hmm.
And we'll hold it for you for a minute. So we'll say a minute has gone by, then suboccipital release. I'm gonna gently let go. How do your headache symptoms feel now?
They seem.
If you had to give me a number.
Yeah, so I think today's headaches were maybe a 7. So maybe I would say like a 6.5 now.
Okay, so just a little bit.
Just a tad bit, yeah. I don't know if that's just because of the feel-good massage or.
Right. Massage can sometimes be good.
Mm-hmm.
Let me have you flip over on your stomach.
Okay.
Any dizziness as you're kind of moving around here?
No.
Okay. Okay, I'm just gonna kind of push down here and just kind of assess a little bit of a motion in your neck here and see if anything's moving. So hypomobile, hyper.
Let's say a little bit hypo.
A little bit hypo. Okay.
I mean, sorry, hyper on the.
Hyper. C3.
Yeah, a little bit hyper.
Hyper. C4.
And that's about neutral-ish.
Neutral. Now we get the C5.
A hypo.
Hypo. C6.
Hypo.
Hypo. And C7.
Hypo.
Hypo. T1.
About the same, yeah. Hypo.
About the same hypo. Move down to T2.
A little hypo.
Little hypo. T3.
Hypo also.
Hypo also. T4.
We'll say the first half of the thoracic is hypo.
First half of thoracic is hypo.
And then it gets to neutral.
Okay. Okay, you can come on up for me, Phil, or Lip. And while I just have you, you can just sit on the edge of the table there. And yeah, we'll go into more. Alright, so Lip, next we're gonna check some range of motion here. So why don't or yeah, you can stay right there, that's okay. I might just kind of get up here on the table just so I can get a good reading on my, this is what we call a goniometer. You ever seen one of these?
I think so.
Yeah, if you ever see one, it means you're in PT. Okay, so for this first measurement, go ahead and look straight ahead. And then I want you to look to your right as far as you can. About 48. Okay, go back to neutral. I want you to look to your left as far as you can. And 60, no, 55. 48 on the right, 55 on the left. Any headache symptoms when you turned either way?
Not too bad, no.
Not too bad, no, but nothing.
No change.
Okay. Any pain when you went to turn your head to the left or right?
No.
Okay. For this next one, it's going to be on your side here. And go ahead and look straight. And I want you to just look down as much as you can. Okay, 35. Okay. Any headache symptoms with that?
No, not too, no.
Okay. Other pain?
No.
All right. Go ahead and look straight ahead one more time. And go ahead and look up for me as far as you can. 30, 33. Okay. Any symptoms with that when you looked up?
Nope.
Okay. Let's see what else. Oh, a couple more. Not done with you yet. Go ahead and look straight forward. Okay. What I want you to do here, I want you to bend your head like you're touching your right ear to your right shoulder. Oops. Sorry. Go ahead and reset. Let's try that one more time.
Okay.
$39 to the right. Okay, we're going to continue that same one, except now we're going to go to the left, whenever you're ready. And 35. pain or symptoms when you went either direction with that?
No.
Okay. So I'll go with that. I'm just gonna test a couple more little things here. So actually, let me come in front of you. Okay. Next, we're gonna do those same ones. I'm just gonna add. So when you turn your head, I'm gonna add a little overpressure. Not a bunch, but just enough to see if we can get a little more range of motion there, because it seems you're very limited. It might be just because, post-injury, which is completely normal. But I just want to see if we can get a little more range of motion, or if that overpressure that I provide will increase any symptoms.
Okay.
So I just want to let you know, you may get an increase of symptoms when I go a little over.
Okay.
Once we hit that limit, you just tell me stop, and we'll go back. Okay? So I want you to go ahead and look to your right. Okay? I'm just going to offer a little bit of anything.
Maybe a little bit.
Okay. You look to your left. Sorry, that didn't hurt. My hand placement was okay?
Yeah.
Okay. Let's have you just look down again. Alright.
It's a little painful.
A little painful with that? With the overpressure? Okay.
Yeah.
Let's do the looking up now. Okay. Any pain with that?
No.
Okay. Let's do, we'll do the one where you kind of bending your head to the side. Let's do your right first. Okay. Any pain?
Yeah, a little bit pain, like kind of in my neck and shoulder.
Okay. But any headache symptoms?
No.
Okay. Let's do the other side now. We'll go to your left. Yep.
About the same.
About the same.
Same as this side.
Oh.
Yeah. Tight on this side as well.
Got it. Okay. All right. That's good. That's good. That's something we can work with. So next, what I want to do, we're gonna do a little special test here. I'm gonna set this aside. I'm gonna have you lay down on your back again. And so, I don't have a timer, but I can kind of count it here. What I'm gonna have you do is we'll lift your head up. You know how to make a double chin? You show me? That's a pretty good double chin. All right. Any pain with that double chin while you're doing that?
No.
No. Well, what we're gonna do, so you can relax. You can relax. So you're gonna make that double chin, and I want you to like pick up your head from my hands a little bit, and you're gonna make that double chin, and you're gonna try not to drop your head into my hands for as long as you can go. Okay.
Okay. You want me to start?
Whenever you're ready, go ahead and start. Yep. Okay. Is that tough?
Yeah, that is really hard.
Why is that hard for you?
I don't know. I just didn't know that was gonna be that hard. It doesn't seem like it's gonna be that hard.
It's hard. Yeah.
Yeah.
So
I think my muscles are just tired too.
yeah, it's later in the day. Muscles
Yeah.
get tired. Deep neck flexor endurance test was 5 seconds. And next we'll do is stay right there. So this is the part where I would improvise. I normally want the other thing.
The one that actually.
The one that actually inflates, but we can just kind of mimic it for the sake of the eval. Just try not to mind this guy. So I've got this little guy inflated. I'm gonna slide it just under your neck here. So this one, I'm gonna have you hold on to this guy with your hand, and we'll imagine there's a scale right here with the needles. So you'll see the needle that says 20, 22, 24, and 26. So for this next test, you're gonna kind of make that double chin where you're pushing your head down onto the bag. And see, when you push your head down on the bag, see that needle move up? Good. That means you're doing it right. So now, what I'm gonna have you do, I want you to push your head down into that bag, but I only want to see that needle get to the 20. And we're gonna hold that for 10 seconds, all right?
Okay.
Whenever you're ready, go ahead. And are you able to do that for 10 seconds?
It's a little hard, yeah.
But you can manage it?
Yeah.
Okay, that's fine. We'll take a little rest here. Now, same thing. I want you to move that needle, this time up to the 22. You're gonna try and hold that for 10 seconds.
Okay.
Whenever you're ready, go ahead. Are you able to hold that for 10 seconds?
No.
Okay.
Like
How many
7?
7 seconds? Okay. All right, so cranial cervical flexion test. Lip was only able to hold for 7 seconds at 22 milligrams or millimeters of mercury. Yeah. All right, so lip, it seems like we're having a little trouble, or that seems a little tough for you. Kind of making that little double chin, right, and holding that.
Yeah.
So the reason that can be tough to do is because you've suffered some trauma, and so what can happen is the muscles down here on your neck, they can get really weak and they can overstretch. And these muscles are really important for keeping our head in space. And that's really important for you. I'm sure you know, as a soccer player, it's important to keep our head in space.
Yeah.
Keep our, what does they say, like keep our head on a swivel, right? And so strengthening those muscles on the front of your neck is very important. So what's happened, they've been really weakened. So we're gonna do an exercise that I like to call the chin tucks.
Okay.
And so you can do this just laying down. So what I want you to practice, and you'll practice this at home, we'll do a couple sets today. But what I want you to do is I want you to take that chin, just laying down right now, and you can even have a pillow behind your head if it makes it better. And I just want you to bring that chin down towards the table. And you're gonna hold that for 5 seconds. 2, 3, 4, 5, relax. Did that feel too hard?
I'm just a little tired from all the other testing and exercises, but
Okay.
yeah, it doesn't seem as hard if I'm not lifting my head up.
Well, I want you to hold those for 5 seconds. I want you to try to do 9 more reps.
Okay.
And then after this, I've got an exercise that'll make things feel a little bit better, okay?
Okay. 10.
Sweet. So Lip was able to complete a set of 10 for 5-second holds. So after doing those, how are you feeling?
I'm very tired.
Okay, very tired. Why don't I have you go ahead and sit up for me? So when I was measuring you with the goniometer, remember that?
Yeah.
We oh yeah, you can see. I was seeing a lot of limitations in your motion, so you're not able to kind of look in all directions as you probably want to. Have you noticed that lately?
Not really, no.
Okay, it might not be noticeable because, you know, this is how you've been for the past few weeks. But if we can get some of that motion back, we should be able to relieve some of those headache symptoms and some of that pain. So this next exercise, all you're gonna need at home is a towel like this.
Okay.
So you'll take this edge of the towel, and is there a specific point back here that maybe flares up or is painful or tender?
I mean, just kind of when you were pressing it earlier, it was a little
Mhm.
tender, but that's the first time I've really noticed it. So.
Okay, and I'll go back to that. When I was kind of pressing on there, I did notice up here, it's kind of, those parts of your neck up there, they move a lot,
Mhm.
but these parts don't really move a lot. Down lower, kind of where my finger is right here.
Okay.
So what you'll do is, we kind of want to restore that motion at those joints right there.
Oh, okay.
Those little bony guys. So what you'll do is you'll take that towel, and you'll kind of line it up. Just, camera can't really see me, but you're gonna line it up right about there.
Okay.
And so once you line that up, you're gonna take this towel, and I like to kind of switch the hands. So when you do this, you kind of switch the hands.
Mhm.
You'll have one across your forehead, right?
Okay.
And then this one will be kind of along your jaw. And what you can do is kind of, this looks a little silly, I know, but you can kind of get a stretch. You're not pulling with this one on the jaw, you're pulling with this one on the top of the head.
Okay.
And you just kind of pull and hold for, however long you can tolerate, but I would say 10 seconds,
Okay.
and then you can leave off.
And you want me to go as far as I can?
As far as you can, pain free.
Okay.
If you start to feel pain, ease off a little bit.
Okay.
And you're gonna do that for 10 seconds, like a nice little stretch, and ease off.
Okay.
So go ahead, I want you to try that. Doesn't matter which side you start on. So just have the crease of the towel. So right there, just the little
Alright.
edge.
Okay. Let's take the glasses off.
Yeah, you can take the glasses off.
Okay, and so you said this one
On your jaw.
on my jaw?
Yep.
And then
And
this
on
one?
top, but you can cross your hands too. You'll get a better pull.
I see.
Yep. So you're gonna pull with this hand and just get that nice rotation. If you feel any pain, back off a little bit.
Mhm.
I want you to try and hold that for 10 seconds.
Okay.
Okay. Did that help relieve any of those headache symptoms or pain? Try doing it 10 times, and then I'll ask you after that.
It kind of hurts, like, that area back here.
Yeah.
A little bit in my neck, maybe. But other than that, maybe. But
Okay.
it doesn't make anything worse except for that pain in my neck.
Pain in your neck.
Yeah, it just feels like that muscle is stretching pretty tight.
Okay, that's normal. Yeah, we want to stretch those tight muscles.
Oh.
It will be that will be painful,
Okay.
and but that's a normal pain.
Okay. Alright.
Perfect. And so, like you just did that looking to your left, you're going to also repeat that on the right side.
And you said hold for 10 seconds and do 10 times?
Yeah. Hold for 10 seconds, 10 times. You'll do those throughout the day.
Okay.
If you ever feel, how do your headaches feel right now as we're talking?
I think I'm at a 6 now.
At a 6?
Yeah.
Okay, good. So this is, what we just did, with me kind of pressing back there, you can have a family member or a friend kind of do that. It's just right at the base of your skull. They can just kind of hold and add a little pressure if your headaches are really flaring up.
Okay.
It can kind of relieve some of that pain, some of that tension. And then this is also an exercise which I'll print off and send home with you. You can use any hand towel and just do that throughout the day. 10-second holds, 10 reps.
Okay.
Let's go ahead and we'll sit down. We'll do some education before you go. So, as you can see, some of these exercises I think will really help and restore some of that motion and reduce some of those headaches. Before I let you go, is there anything else that I might not have asked that you think is really important that I should know?
Yeah, so I know last time we were here, it kind of upset me that you said we probably won't be, we might be seeing each other for maybe 12 weeks, which feels like a long time, and my parents are really pushing me to get into soccer. I really want to get into soccer, I need the scholarship. So like I like it's kind of frustrating me. Like I really want to get going, and this is a lot of weight on my shoulders right now.
Okay. Yeah, no, I understand. It can be very frustrating. So when you say you got this big shoulder on your weights, trying to get back into soccer so soon, I feel like there might be something else going on. Is there any stress I need to know about that you would like me to know so we can give you the best treatment and just get you back to health as soon as possible?
I mean, honestly, like I just feel like I don't even want to go through all this. Like I just want to feel like I can just go back to soccer and just kind of push through the pain. And like I said, this is very important. I just kind of want to just go to that game, like no matter how my health is doing.
Well, I understand you're frustrated. This is your health. I know. Jeez.
Also, like my parents are also a huge part of this too, and like they keep mentioning it at dinners and like I don't know.
Yeah.
They're just a huge stress.
12 weeks, like you said, that is a long time to be in physical therapy, and that's just like long term. It might not even be that long. If we start to see a lot of improvements here, you can be out as quick as 4 weeks. I know that sounds like a long time, but it really isn't. Maybe even 2 weeks. It's just really it's imperative. It's so important that you don't return to sports while you still have these symptoms, because if you get another concussion, it could be even worse, and then you might not even be able to play college soccer. And I don't want that for you, and I'm sure your parents don't want that for you.
Yeah.
If it makes it easier, I would be more than happy to talk, in the same room with you and your parents, and we can kind of bridge that gap, because I want them to understand that this is a big deal. I understand soccer is a huge deal in your family, it sounds like.
Yeah, it really is.
But your health comes first. It always comes first. So when you tell me you got all this pressure, I feel kind of sorry that you have to feel so much of this pressure and that you have to go through all this. But I really want what's best for you, and that's just to get back and healthy and back into sport, but only if we can get you back into sports safely. So, I'll ask you one last question. Would you like to have, or would you like you and me and your parents in the same room to have that conversation sometime in the future?
Yeah, I mean, when I explain things to my parents, they kind of, like when you explain things, it kind of gets me on your side, but then I try to explain it to my parents and then I get back on their side, and I'm just kind of confused, like what I should be doing. So yeah, I think having you guys talk one-on-one will, we can hopefully come together on how to do this.
Yeah, I'd love to talk with them. I think it would be really good. I think it could help get some of the stress off your shoulders, and maybe we can even see you more frequently in physical therapy, because the more we see you, then you'll probably get out of here sooner. I think it's a realistic possibility with what we've seen today.
Okay.
Yeah. But besides that, are there any other questions, any burning questions you'd like to ask before we let you go?
Nope, I don't think so.
All right, well, hey, you take care. Have a great day.
Thank you.
Gosh, I don't know how that